Ruben, thank you. Also up in D.C. this week, Robert F. Kennedy Jr. has been on Capitol Hill working to win over skeptical senators ahead of his upcoming confirmation hearing to lead the Department of Health and Human Services. The nomination of Kennedy, an outspoken opponent of vaccines, has sparked some concern in the medical community. So what could him leading HHS look like and its impact right here in North Carolina? Joining us for more on this is Rose Hoban, founder, editor, and reporter at North Carolina Health News and a great friend of the program. Rose, first of all, it's great to see you. Appreciate your time.
So good to see you, Tim. It's been a while.
I know, it's been too long. All right, so have we got any reaction? I know people probably don't want to talk about it yet because he's a nominee and hasn't been confirmed and all that, but I imagine, especially in the public health realm, that there's a lot of scuttlebutt about what this could potentially mean.
There's a lot of off-the-record conversations about concerns about what RFK could mean for things like vaccination rates. A lot of folks aren't speaking on the record, though. They're kind of keeping their powder dry just because they understand that they have to work with the new administration. So I'm getting folks who are sort of saying, yeah, come talk to me a little bit later. But for the most part, they're very concerned. There's a lot of thrumming underneath the surface about people who are concerned.
And is it vaccinations largely that people are concerned about? I know we were just talking off camera about Samoa and the impact of that. Is that at the sort of the top of the list?
Vaccinations are definitely top of the list. So you mentioned Samoa. For example, there was a big measles outbreak in Samoa, if I remember correctly. I think it was 2019, where something like 3,700 people got sick. The Samoa situation started when there were nurses who were mixing up the vaccine, like it comes in a powdered form and you put in a liquid and then you administer it, and they put the wrong diluent, the wrong liquid into the vials, and 2 children died. And so that mistake was exploited by anti-vaccine activists, including RFK's group, Children's Health Defense. Many of them visited Samoa. It became a cause célèbre, and there was a lot of misinformation in the country about the safety of vaccines. And so the vaccination rates dropped from like the 70-something% down to about 34-35%. And sure enough, measles is an incredibly contagious disease. It is probably the most contagious disease. And so there was someone who had measles, visited Samoa. There was a huge outbreak. Thousands of people got sick, and more than 80 people died, mostly children who died. And in the meantime, the United Nations sent, more than 100,000 doses of vaccine, along with other entities sent vaccine, and there was a real push to vaccinate. But RFK's group was very much implied in the misinformation around the measles vaccine. If I remember correctly, they even implied that it was the vaccine that was killing children, not the measles itself. And then today in the New York Times, there was just a report that the country of Congo has an ongoing measles outbreak that has killed thousands of children. So the measles vaccine has saved hundreds of thousands of lives. And as you know, Tim, but maybe your viewers don't, I'm a nurse. And before I transferred into reporting, I worked for Doctors Without Borders. And when I worked in a refugee camp in Indonesia, when I would go to camp, the moms would literally be pulling on my clothes as I walked through camp saying, please, can we vaccinate my children, vaccinate my babies? And they really wanted vaccines for their children because they knew how incredibly dangerous measles is. So here you have someone who's on the record quite prominently casting doubt on the efficacy and the safety of the measles vaccine, among others, and now he's been tapped to lead the country's health and human services apparatus. So I think people are very worried.
What do you think it means? So let's say he makes some of these broader decisions at a national level. And then is it up to states at that point if they want to continue some of these types of things? And how do you think that plays out? Because we have a Democratic governor and we have a Republican legislature. Could we see these fights then play out in North Carolina potentially too?
It's not as simple as that, right? I don't think Robert Kennedy would say we can't vaccinate, right? And I don't think that's within the purview of the Secretary of Health and Human Services. Instead, though, what could happen is he could undermine public credibility in vaccines. So you would have state officials encouraging people to get vaccines, in a place like North Carolina. And then at the same time, you would have federal officials kind of downplaying the importance, efficacy, safety, et cetera. That's the kind of thing that people are worried about. They're not worried necessarily about that he's going to ban vaccines. They're worried about the messaging. And there's been so much misinformation. A lot of the doubt about the measles vaccine came from a now retracted and a study out of the UK. Done by a doctor named Andrew Wakefield. He looked at 12 children at his kid's birthday party. It should never have been published to begin with. And it questioned the safety of the measles, mumps, and rubella vaccine and saying that it caused autism. There have been millions upon millions of dollars in research funding spent in that time since that was published, spent refuting that claim. But, it's one of these things. The genie is out of the bottle, and it's really hard to put it back in.
Rose, good to see you. Thank you so much. I have a hunch we're going to be talking a lot next year. I appreciate your time.
I have a feeling that's going to be the case, Tim. Happy holidays.
Thank you. We look forward to it, though, because we always appreciate talking to you.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.